we put some of the latest weight loss trends making headlines to the test. And gastroenterologist Dr. Robin Chutkan is here with another one I guarantee you've never heard about. So explain to us some of this interesting research that you've been doing.
So this is brand new. There've only been 10 patients who've had this procedure. And imagine what it feels like when you're at the Thanksgiving table, you've had a huge meal and you push back, you feel really full. And this is what this procedure does. And what it involves is a procedure that we as gastroenterologists do every day with our trusty endoscopes. This is an endoscope here. It's usually attached to a machine.
Jim, you're gonna have to open up here.
And you don't mind if I just do a procedure on you right now, do you? And we basically inject botulinum toxin into the stomach. And we put the scope down, the patient's sedated, so they're asleep. This is a catheter that gets threaded through the endoscope, and then if you push down on this, you'll see a little needle coming out. Okay, yeah. And then we have the botulinum toxin in this syringe and we inject it into the wall of the stomach.
And we have some video if you can talk us through what we're looking at, because this is once you're inside, you're looking at the scope.
So there's the stomach and you can see there's a needle with a botulinum toxin in it, and you see that contraction, that's peristalsis. Those are the normal contractions of the stomach. You're gonna see one again, and that's what helps to churn the food up and to push it down through the intestines. So we're injecting in the stomach here the botulinum toxin, and then you're going to see the stomach become pretty still. The peak effect takes about 2 to 3 weeks, just like botulinum toxin in the skin, where it takes a few weeks to kick in. It's the same thing in the stomach. And what it does is it temporarily relaxes the muscles of the stomach so that it can't contract as vigorously and you feel full faster and you eat less food.
The food stays in the stomach longer?
That's exactly right. It delays the emptying time, and it also cuts the maximum tolerated volume, the amount of food or liquid it takes for you to feel full, in half in the clinical trials.